Warm greetings from African Renaissance TV. This is the Maternity Show with me, Sona Dabo. This episode is a special one that I've been looking forward to for a long time, and here it is. Because I try to put myself in situations where I receive messages from lots of people and be like, Sona, we need a pint or two of blood, so group to donate to a woman that is in labor or a woman that has delivered. So we are grateful that we are having this discussion, of course, with Mariama, the program head for National Blood Transfusion Unit of the Gambia. Mariama, you're welcome to the Maternity Show.
Thank you for having me, Sona.
It's a pleasure. So blood has really been an issue for lots of the people in the Gambia, not just for women. But today we are going to discuss specifically how this has been a very big problem for women that are pregnant and women that also go through labor. So we also understand that blood has been one key factor that could lead to a lot of women dying during labor or even after labor. We call it maternal mortality. So we want to understand from your unit how this can be taken care of in the long run. We would have to understand maybe what blood transfusion is, when should a person be eligible to donate this blood, and then where and how should this process be done. But let's just begin with what is blood transfusion first.
Good question, Shona. This is a very important topic. So blood transfusion is the process of taking blood from a healthy individual called a donor, who can either be a voluntary donor or a relative donor, processing that blood and giving it to a patient who is in need or someone who actually needs blood to support his or her survival, to increase his opportunity to live. So that's the process of blood transfusion. And then you have what you call blood donation, which is part of blood donation transfusion, which is the process of giving out blood. It has a whole process from the beginning of getting the donor, the sensitization and stuff. So blood donation is the process of giving out blood, either voluntarily or due to a family replacement donation.
Yeah. So blood donation has been an issue that we are really concerned about lately, because we know that on a daily basis we've been receiving messages from people that they need someone to go and donate blood. But in most cases what we find difficult is to get this donor. So I think there is a need for us to really examine and for the people to also understand who should donate blood. Is it both male and female? So who has the upper hand in donating as well?
So in terms of blood donation, anyone can donate blood as long as you are healthy. However, there is a criteria for both male and female donors. Both male and female can donate, whether you're a man, whether you're a woman. If you're a child, you cannot donate, but if you're an adult, from the age of 16, you are actually qualified to donate if you meet all the criteria. So anyone from 16 to 65 can actually donate blood of age. To be a blood donor, you have to be someone who is healthy. You don't have to be someone who is not feeling well, who is not sick. You don't have to have any chronic diseases or infections. And most of the time, you get to know this when you get tested or when you go to the hospital. Yeah? So both male and females can donate, although men stand at a better chance because for women, if you look at our physiological makeup, usually a lot of things limit our donations. So one of them is the menstrual cycle. If we are expected to actually bleed once in a month, so a week, 2 weeks before the bleeding, you cannot actually donate. A week after, so some days after the bleeding, you cannot actually donate. So there are exemptions to women. If you are breastfeeding, you cannot actually donate as a woman. So there are a lot of exemptions why women cannot donate, but that does not stop us from donating. So men can actually give every 3 months as voluntary donors, but women can give every 4 months as voluntary donors. Some actually allow women to give for 6 months, but from every 4 months, a woman should be able to actually donate blood, basically.
Yeah, so that is clear. and we understand that most of us that will run away from blood donation, it's not a reason for us to run away, because we just have to understand when we should donate and when we should not donate. So let's look at, for instance, people that want to donate but don't know what to do to donate. This could be probably they don't know their own blood group, or they don't know who they should donate to, even if they know their blood group. So basically, we're examining the blood groups now.
This is important. The first thing is, whether you are a blood donor or not, it is important to know your blood group, because your blood group is actually inherited. Yeah, so you get your blood group from your parents. It's genetical. It's a genetical makeup. You inherit one copy from your mother, one from your father, and then depending on which one you inherit, that gives you your blood group. So these are antigens on the surface of our red cells. So whether you donate blood or not, it's important to know your blood group, because you can be a blood recipient at a point. No one knows. You know, like the saying goes, the blood you donate can actually save your life. So it is important for people to know their blood groups. One, how do you know your blood group? If you go to any hospital you go to, and major health facility, they should be able to do your blood group. Just go to the lab and tell them that you want to know your blood group, because you may become a potential blood donor. Yeah. The easiest way basically to know your blood group is to become a voluntary blood donor. Yeah. So in terms of blood donation, what we have in the Gambia is voluntary and family replacement. And most of the people come out to donate for families, for friends, or when someone they know is in need of blood. That is not the best way. So to know your blood group, if you come to donate blood voluntarily, basically it's one of the health checks that people do. You will have to know your blood group so that you know who actually can. You don't have to know the person who's going to use your blood if the person is not a family as a voluntary donor, but it's important to know your blood group so that the person they are giving to, the blood is going to be given to, it can be given to a corresponding group. Because the group you are donating to the person must be a specific group. You cannot just give it to anyone. Yeah. So you have the different types of blood groups as well. You have about 8 different types. Basically, people will think it's 4 types, but each of those 4 groups actually have 2. Yeah. So if you talk about blood group A, blood group AB, blood group B, and blood group O. These are just 4 groups, but basically these groups you also have to type them to either be positive or negative. So if you talk about blood group A, you have the A positive and the A negative. You talk about B, you have the B positive and the B negative. You talk about AB, you have AB positive, AB negative, and the O, you have the O positive and the O negative. And that is very important to note, because this is where you have what you call the who is qualified to be a recipient donor. There is a special group that can receive blood from anyone. As long as the person is, the other screenings are all okay. And there's a special group that can give blood to any other person. So that is why it's beyond just 4 groups. It's important for people to know that each of those groups actually have 2, subgroups.
Okay. So like let's also look at, for instance, I am A positive that I know some years ago. Can I donate to all this, all the rest of the 7, or all the 8?
So when you are A positive, you cannot donate. You can only donate to A positive, basically. You cannot even donate. You are not even allowed to donate to A negative. Yeah. That is the only group that is allowed to donate to all the groups is the O negative. Not O, even the O, and that is what you call the universal donor. So basically, people will tell you O is the universal donor, but it's not just O, it's the O negative. Because the O positive has no antigens, but it has what you call antibodies, right? So it has what you call the antibodies, but it has the D antigens. So if you transfuse the O positive to the O negative, you will cause some complications. Right? But the O negative basically has no ABO antigen and has no resource antigen. So it is a universal donor. Any other group can receive from O negative without any issues. And then the AB positive, basically, people will tell me, if I am AB, I can receive blood for anyone. It's not just the AB, it is the AB positive. If you are AB negative, you are not supposed to receive blood from everyone, apart from those who are corresponding to your group, right? But if you are AB negative, you can. If you are AB negative, you can receive blood to any other person because you don't have any antigen. You don't have the ABO antigens. You don't have the D antigens. So there won't be any reaction for the antibody. There won't be any antigens for the antibody to attach to and cause a reaction or a problem. Okay. So it is the AB negative, AB positive, which is actually the universal recipient, and it is the O negative that is the universal donor. So if you are A positive or if you are group A, you can basically just give to group A. It's only in very exceptional cases, very, very exceptional cases and emergencies, which is usually between a life and death, that you can actually consider. But even with that, you have to get the clinician to give approval, because they will have to manage the patient after that.
Okay, yeah. That is really important for us to understand, because I know we run a group that usually people will be asking us questions around where can I know my blood group, who should I be able to donate to. So with this, we can tell a lot of people who they should donate to and who they cannot even donate to. That will now lead us to our next question on really how available blood is for women, especially in the Gambia.
Great. So blood availability is steadily increasing. We are not able to meet the demand. The demand is so huge that there is a lot of differences between the demand and the current supply. So if you look at our current estimate, we need about 48,000 blood pints to meet the demand, the population demand of the Gambia.
Every year?
Every year. Okay. So currently, according to the current population rate we have, growth rate we have, you need about 48,000 pints or units of blood per year to meet the demand. Currently, we are only able to produce just a little bit above 16,000. Okay, so 16,000 and 48,000, you have more than 30,000 gap units of blood. So the demand, the availability of blood is still a challenge. The demand is always very high, and it's always there's always a need for blood transfusion. Every minute, every second, you know, someone somewhere in a hospital is in need of blood transfusion, right? But this is not corresponding to the supplies. In terms of access to blood transfusion as well, it is a challenge. Yes, it is steadily increasing. The number of health facilities conducting blood transfusion is also on the increase, but there is still a big challenge, because sometimes people have to go beyond 30 kilometers to get transfused. We only have about 11 public health facilities that conduct transfusion. We are in the verge of adding 2 more to this, and some are being constructed, which actually increase the number of blood transfusion sites. But currently, access is also a problem, particularly in the upper regions, where you have basically just one just one district hospital or general hospital that is conducting blood transfusion services in a whole region. So access is a challenge.
Yeah, so apart from access, what other things can we mention to be challenges for blood availability?
So when you talk about blood availability, the preferred way of ensuring blood availability and safety, because availability has to go with safety. Yeah. Even if we make blood available and the safety part of it, the blood that we are giving is not safe, then we are causing more complications, or we may be causing more problems rather than solving issues. Okay. So in terms of making blood available and safe, one of the challenges is having access to the community. So as a national blood transfusion program, we have different branches that operate. We have a branch called donor recruitment, and the idea is to get 100% voluntary blood donation in the country, because according to WHO, that is the only way that you can ensure blood availability to all the patients in need on time, right? So currently, we have more family-dependent donors. We depend more on family replacements. So people come out to donate when there is a family, when someone they know or a family member is in need. And this is usually in emergencies most of the time, right? So they come to donate because at that time there is no blood in the bank, or there's no matching unit of blood in the bank. And the time you take to call the family to come to do the processes, you know, the one family member will come, the blood, the group is not the same, or the family, the person who came to donate is not fit to donate. You will have to go and look for another person. So that time can actually give the patient more complications. You know,
so what I was wondering, along the line, before the patient gets to that critical moment, let's say if it's a pregnant woman, before the labor, this could have been communicated that you might need a donor.
Yes.
So that person should be able to identify these people.
Yes, so this is one of the strategies that we are putting in place to ensure that women, particularly women at the childbearing age, those who come to give birth, always have a pint of blood on standby. Okay. Yeah. In most of the facilities, in most of the hospitals, usually if you are an antenatal mother, during your antenatal visits, you'll be cancelled. They'll even invite your husband if he's around to make sure that they come to support you. When you are coming for delivery, they come. Or in places like Bundu Maternal and Child Health Hospital, and few other hospitals, the strategies we are putting in place, or that have been put in place, is that every pregnant mother will actually have a pint of blood stored for them, donated by the family, whether the husband or someone they know, before they go into labor.
Okay.
So a few weeks before labor, they get this pint, because you can actually store a whole blood pint for a month plus, right? You can actually store it for about 35 days.
But so, you were worried about the safety of the blood.
Yes. So
and with our current power supply issue.
Yeah, so most of these hospitals also do have backup systems. Okay. So you don't have that long intermittent power outages, okay. Right? They will have some generator backups and stuff as well.
Yeah.
So they don't donate for a whole month, but few weeks or few days before delivery, they actually come to donate. Or it can be negotiated that when this lady is being transported to the hospital for delivery, when they are due, they come with an escort who can actually donate. Yeah. So there's always something on standby. But this is the strategies we are putting in place. Most of the hospitals are implementing it, but it's not yet 100%. So we are still having issues of having to rush out. And also remember, sometimes women who come into labor have what you call hemorrhages. They have unexpected bleeding, where the woman is bleeding profusely, and the clinician may need more than 1 pint of blood to actually correct this or replace the lost blood. So even if you have 1 unit, you will still have to look for donors if there is no matching blood or enough blood in the blood bank at that point. Yeah.
So I like the strategy that Bundung has adopted, but it's important also, because in my last episode with Dr. Jarvis, he also mentioned about their strategy when the woman would come for early booking. And they will always advise that the man should be available,
yes.
To have more male involvement. That would also increase their chances of reducing the need for blood during delivery here and there. But we will just take a quick break and then come back with the rest of the questions. All right, welcome back from that break. If you're joining us now, this is the Maternity Show on African Renaissance TV with me, Sona Dabo, and our episode is specially focused on blood transfusion in the Gambia with the head of blood transfusion unit, Mariama Jame. So Mariama, before we left for the break, we were discussing the best strategies that we can use to make sure we reduce the urgent need for blood. That will now lead us to our next question, because some few weeks ago, I realized that your unit was on a policy and strategic plan validation to come up with documents that will aid the work that you do in the Gambia. Take us through that. How will that be of quality? How will that produce quality in the work that you do already?
So like you said, last week we were validating our National Blood Transfusion Policy and Strategic Plan 2024 to 2028. These are very important documents. So the policy is the guidance. So blood transfusion is a whole process that involves a lot. 60% of blood transfusion work is community-based, because the idea is the target is to get 100% voluntary blood donation, which is the safest pool of blood donors, basically, according to WHO, right? And evidence base. Yeah. So to get that, you have to have a policy directive, because if you have 60% of the blood transfusion work, community-based, and then the rest, 40%, is what you do at the clinical site, getting the blood, screening the blood, doing the compatibility testing for the patient and the donor, and also transfusing the blood and observing or monitoring these patients for the good outcome. So you need to get a policy that will actually guide our operations, right? The other document that we validated and endorsed is basically the strategic plan. So for all what we have what we have been talking about is about how do we improve the blood transfusion services, how do we ensure that safe blood is available, continuously available for the population. So we need to have strategies to do that. So we hired a WHO consultant, an expert, who came to support the Gambia in ensuring that we document these strategies that can actually be implemented. So most of the strategies, or one of the strategies, is to ensure that we have a blood donor recruitment and retention plan. And this is to ensure that you have plans on how to sensitize the population, to educate the population, what is needed to do that, how can you convince the population to know the importance of blood donation, and make sure that you have 100% youth population basically going into blood donation, or at least 80% of the population going into blood donation. The other strategy is to ensure that the ministry or the government actually prioritizes blood transfusion, which is already a priority, but funding, how do we ensure, because going into the communities, blood transfusion is expensive. It sounds cheap, but it's expensive. You need logistics to go into the community, to sensitize people. You need to motivate these blood donors. You don't have to pay them, but they need incentives. They need, when people are coming out to donate in groups, they need to be transported. You need to give them refreshment or at least water after donation. So all this is expensive. When you come to the clinical side, the blood that you collect, in terms of safety, you don't just go and give out the blood. You have to screen this blood. You have to type their groups. You have to make sure that any blood that is actually reactive or positive, contact the donor, the voluntary donor, based on the person's consent, and actually refer them to a clinician or where they can actually get care. And this is a way of actually having to control some of these transfusion transmissible infections as well. So we have to have strategies and plans to help us actually implement. And this is very important for the fact that the Ministry of Health, in partnership with the World Bank, are currently constructing the first ever National Blood Transfusion Center in the Gambia. All the countries, every country that is running a standard blood transfusion service needs to have a National Blood Transfusion Center. So this is going to be the main center where you will have the collection, production, processing of blood, so that only blood that is ready to use will actually be sent out to the hospitals. In this way, you can ensure availability, because there will be continuous recruitment activities based on the strategies you have developed, right? And also you will ensure safety and quality of this blood, because this is actually confined to a certain institution that is taking up that responsibility. So you're going to have your scientists, you're going to have your molecular techniques and methods that can actually, detect infections or viruses at the early stage, so that the chances of transmitting these infections via blood transfusion, like HIV, hepatitis B, hepatitis B, C, and actually syphilis, and more others, can actually be very limited. So in order to ensure the safety of the blood that we are giving out and the quality, we need the strategies that we just validated.
So I think that is a good step in the right direction, and then we are looking forward to visiting that center one day. So I just want us to go back a little on the availability issue, because I want to know, why do we still need to encourage our people out there to be able to donate blood? Because it's more or less like encouragement. You did mention that we will need to depend on voluntary donation more as compared to family donation. I am not sure why this should be the case, but I want to believe that the family issue could be, they might have some genetical issues here and there. But with the voluntary donors as well, we're still having a huge chunk that are refusing to go and donate. Do we, or does your unit understand the situation that these people would bank on to not go and donate blood to the needy?
Yes. So to start with, preferably, like I said earlier, what we want is to get more voluntary donors. Currently, it's just far below family-dependent donors. out of the 100% voluntary donation we are yearning for, we are only at about 35%. Yeah. So the advantage of having voluntary donors over the family donation is that, one, for safety purposes. So if you have a donor who is a family donor, they only come up when there is a need. Yeah. So coming up as a family donor, all you are looking at is to save your family member at that point. So in terms of blood donation, it is a process, and one of the processes to start with is the counseling. So usually when you come to donate, you get someone to talk to you about why you need to donate. You should be healthy to be a donor. You should be fit. And talking about fitness, it's not only to prevent you, but also to prevent the patient you are giving blood to, because we want to make sure the blood we are giving is actually safe, to cut down the rate of transmission. So they ask you questions related to your lifestyle to ensure that you are not at risk or part of the risk group, what we term the risk groups for blood transmission, for transmission of these infections. Yeah. So at that point, you can actually be deferred. If you are not feeling well, or if we think that there is a reason for you not to donate because it's either risky for you as a donor or for the patient you are donating to, then you can be deferred. And the deferral system can also be temporal depending on the condition, or it can be permanent, right? So that is to ensure that there is safety. And in terms of availability, we cannot bang on the family-dependent donors. We need voluntary donors. We need blood to be continuously available in the bank. So if people are only coming to donate to their family members, it means you are taking it away. It's just like your bank. Yeah. You're putting money today, you're taking it out tomorrow. If you put in today and you are saying, okay, I write it, you put it today, you give a check to someone to withdraw it. Obviously, there won't be anything, right? So basically, you have to keep that money in there for future use. So we have to be supplying the blood banks with safe blood from the voluntary donors. Yeah. So for the voluntary donors, it's two advantages. One, to ensure there is continuous availability, we have to depend on voluntary donations. Yeah. And two, to ensure there is safety, because if I'm a voluntary donor and you are a repeated voluntary donor or regular who is coming to donate every 3 months or at least every 6 months, right? Anytime you come, you are tested for these viruses, you are tested for certain things, they check up, and you are fine, then you are more of a reliable supplier. Yeah. So even though the next time you come, we are still going to go through the same process, but we are more convinced that the blood you are giving currently is safer than the family donor because of looking at the window period of some of these infections. Sure. Yeah. Because the current test kits we are using may have some limitations. So that is why we try to counsel and encourage voluntary donations as well, to make sure there is continuous availability and safety of the blood we are giving out. Yeah, that makes sense actually, because some of us would never had. One of your questions, to finish your question with why people may be not coming forward to donate. I think there are so many misconceptions when it's come to blood donation. Sometimes people will tell you, I am not fit to donate, but the person telling you I'm not fit to donate have never gone to test. So you don't just go and they get you bled or they bleed you, take blood from you. No, it is a process, and it is very advantageous to people coming to donate, because the idea is if you go to donate blood, you do about 3 to 4 tests that if you go to do on a routine checkup, you're going to pay a lot of money. But all this is carried out for free as a voluntary donor, and you get a feedback. So that helps you to know your health status, right? They do your BP and all that. That helps you to know your health status, basically. And once you know your health status, you'll actually be motivated to maintain it. Yeah. God forbid, if you come out and find out that you are, for example, hepatitis B positive, we don't leave it at that. You are actually counseled and referred to the experts, to the clinicians. So that's another advantage, where you can actually go and get in. So people don't have misconceptions that I am not fit to donate. But until you go there, get screened and tested, then you can actually say, yes, I am not fit. And then if you are not fit, they can help you get support. Yeah. The other thing is people think there is the other major misconception is that blood is actually sold out at the transfusion centers. So this is a very big misconception that people need to be clear about. There is no way that people do sell blood at the blood banks, right? So it is against the National Blood Transfusion Policy. If you are caught selling blood with evidence, the law will take its due. You will actually you'll actually be taken through the due process. There is nowhere that you are allowed to send blood. And this is one thing why we are actually discouraging paid donors.
Yeah.
Because if we encourage paid donation or the issue of blood money transaction, then even people who we deem to be at risk groups will actually come and donate.
Yeah.
And if they don't tell you their true story, you can bleed them, at a time when they are maybe in the early window periods, and you can transfuse that blood, which may actually contain some infections, infectious disease. Exactly, the test will not show what it is. So basically, if you go to any center, you have donated blood, or you have the evidence that I have donated blood, or someone donated blood, and this person has sold blood, you can actually reach out to the authorities, and they will know what to do with that person, and they will give you a feedback. So there's no way that sometimes maybe transactions will actually happen when people are in need. A family member goes out to look for a donor outside, whatever they arrange behind, outside the lab, that is not the facility's responsibility, because it is beyond our control to know what they have discussed. But once you come, we make it clear to every donor that either you come as a family donor, replacement donor, or relative replacement donor, or as a voluntary donor, but you are not here as a paid donor. And there is no way that blood is actual. Sometimes people will come and say, I'm here to buy blood. And we tell you, sorry, this is not a pharmacy. If blood is available for procurement, then basically we can even have them stocked at the various pharmacies. But unfortunately, we have to make it clear. So that's a misconception, even for the people, the escorts we have, because people come to the hospital and instead of telling you that my patient needs blood, they'll tell you the doctor says to come and look for blood here, so I need to buy it, how much will it cost? So you need to have to explain. So we need a lot of sensitization basically to take out most of these misconceptions, and people will tell you women should not donate, so many misconceptions. But with a number of, with the amount of sensitization that we are doing, which actually needs to be intensified, we are sure we'll actually change the mindset of people.
Yeah, and we are hoping that it will move from the 16,000 to at least maybe close to 30 plus.
Inshallah.
So we also have a lot of blood donor associations. We know the Red Cross is very key in terms of blood donation, and other communal associations. What plans do we have for them?
So currently we are still working with most of the blood donor associations, right? We have a number of them that MOUs have already been signed with. We have few that do not have the MOUs signed with, but we are still in correspondence and we work with them. So currently, for example, the Red Cross, which is, is one of the biggest youth platform in the country, we work with them. Sometimes they do their own organizations and they call us to coordinate for collection, for blood collection. Sometimes we contact them, put them into our activities and so on. So we are not leaving the associations behind. Most of these associations, when we are conducting some regional activities, we actually select them. The major ones in particular, let's say you have the Sokoto Blood Donor Association, you have the Pipeline Blood Donor Association, the CRR Regional Blood Donor Association, and many others that we are working. We are always in touch. They have their executives. When we have our blood transfusion activities, some of the trainings, sometimes we invite them as well. Just the document we validated to get their inputs. During the review, not the validation, during the review, we invited few executives from few of the associations when we are having the commemorations. But it doesn't stop there. We want to intensify our collaboration with them, because we are looking at voluntary blood donation basically to get more support from the community. And these are structures that work directly with the people at community level. So in fact, they are better people. They are a better group in terms of convincing people or motivating people to donate. Because yes, it is our work, but this is something that we are paid for, even though we have passion for it, so we go extra. But someone who is voluntarily doing it, going out to do sensitization. So sometimes we give them the lead in terms of sensitization activities. We support them, they do the sensitization, and then we go and do the blood collection. Because what we understand from the experience is that communities tend to listen more to them, because it is the same people who support their community members when they are in need of blood. So obviously, if you don't listen when you are in need, you will be forced to listen. So it's important that we strengthen our collaboration with them.
Yeah.
And we are hoping to have more of these blood donor associations in other areas as well.
Yeah, so I would have wished that we continue this discussion, but I'm not sure time would permit us. I would specially have another show with probably the Red Cross also understand their work in terms of blood donation to women in need, because it's an issue. Every day, even this morning, I received a text message that another woman needs blood. So we want to understand why this is happening and how we can, curb the situation along the line. But before we let you go, maybe you should let us understand what challenges you have at your unit level.
Yeah. So as a department or a unit under the Ministry of Health, a lot has been done. We've got a lot of commitment from the ministry and support, but yet still there is a number of challenges that we are registering. Yeah. Like I said, a good percentage of this work should be community-based because we have blood donor recruiters and recruitment officers that are supposed to be going out to sensitize. But if you look at the rate of sensitization we are doing, we are moving at a very slow rate, right? We don't have a lot of sensitization going on because we don't have the capacity in terms of logistics. Yeah, you will need vehicles, you will need people to fuel those vehicles for people to be able to go into the communities and do sensitization, and even to go and collect. Yeah, you have what we call mobile bleeding vans. They are refrigerated vans where you have refrigerated or bleeding couches that you can go and do. But we haven't gotten that yet. So transportation or transport logistics is usually a challenge. Okay? The other challenge we have is that we have the misconceptions. How do we clear these misconceptions? Okay. Yeah. But in terms of doing that, the sensitizations will actually do that. Currently, we are having few partners, the WHO and the World Bank, who are supporting our recruitment and sensitization programs. But we will need a lot of support. So we have challenges in terms of conducting these sensitization programs because of the lack of logistics that we have and the high family-dependent donations. One important thing that people should know is that not only do pregnant women or blood, it's not only women that basically use blood. You have other cases. The rate of accidents is very high in this country now. Sure, and most of these accidents, people bleed and they need blood to correct it. Yeah. So even though there are other alternatives blood transfusion, but there are cases that definitely need blood to ensure that their survival rate is actually increased. Okay? Yeah. There's a lot of surgeries, health, patient management, patient care is actually improving. A lot of surgical interventions are also taking place. And if you look at that, the principle is at least any patient going for surgery, whether it's emergency or elective, should have 1 pint of blood on standby. Whether the patient will use it or not, that will depend on the clinician. Yeah. All of these, where will this blood come from if we don't donate? Coming back to maternal cases, every day women are going into labor. Not only labor, but sometimes antenatals can actually be anemic. Anemia, we know, is very, very common in the Gambia, particularly for pregnant women and children. So sometimes it is important to know why women need this blood. And women go into labor, they actually bleed. Some bleed so much that they will need more than 3 pints, So it is important. So the time we are using to call for people to come and donate is actually not advantageous to these women. It could cause a lot of complications, So it's important for people to come out and donate voluntarily. We should not wait to be called to come and donate. Yeah. That's how important it is. Not only to make the blood available, but like I said from the beginning, for the safety of that blood. Because if we are rushing to save the life of this patient just because he's got maybe a few hours left that he may die if there is no blood, there could be the safety, the rush, yes, there could be rush in the tests and other things, and we are humans. Yeah. Even though we try to avoid that as much as possible, but I think the safest way is to have a good bank of blood where you will have safe blood screen already available, waiting for patients to give it to.
All right, so in maybe 1 minute, let's just say, what are the way forwards for all of us?
So the way forward is for every person to take responsibility when it comes to blood donation. Right. Yeah, let's all be blood donors. You can donate directly or indirectly, right? We cannot all support patients. We cannot all go to the hospital to save lives. In terms of medical interventions, we cannot all be clinicians. But we can support or we can contribute to saving life by giving blood. You can either give blood directly or you can be an advocate. If you are not fit to donate, there are people who are definitely will never be fit to donate because of their medical conditions. Yeah, if you are carriers, sickle cell patients, or other conditions, you may not be fit. But you can actually advocate. You can talk to people. You can, put your resources into blood donation activities. And basically, people who donate, people who support blood donation activities, we cannot pay them.
No,
because it's like sharing your life. So it's only Allah subhanahu wa ta'ala who can actually pay for sharing your life, because He is the life giver. But if you are someone who is supporting, life in giving blood, a commodity that cannot be procured from anywhere, then I think it was investing in. So you either invest your time, you can invest your energy, you can even invest your money. It's never going to be a waste, because every day someone somewhere is in need of blood, and one pint of blood you give can actually save 2 lives. So
that is quite important for everybody to really understand how they can take part in helping the patients. So before we wrap up, I know we have been signaled that it's already time. What would you say to the viewers out there?
So to the viewers out there, let us all be advocates of blood donation. Let us all be blood donors. If you cannot donate directly, please donate indirectly by talking to people about the importance of blood donation. Gambia is a small community. We are all related in one way or the other, or we know each other. And the life you save may actually be your own. No one knows. It's not only the maternal mothers or women who need blood. We can have blood. The rate of accidents, surgical cases, there are so many non-communicable diseases currently, a lot of cancers and stuff, and blood transfusion is needed on a daily basis. So please be advocates, put your energy, put your money, let it be a daily business for all of us. Thank you.
Thank you very much, Mariama, for being with us here on this episode, and really appreciate the time you took to discuss with the viewers on this very important episode. Therefore, she did say the life you save today might be your own life. We are going to cut it short here until we come your way next. This was blood transfusion discussion with Mariama, the head of the blood transfusion unit in the Gambia. We will just have to remind you that this show is still open for sponsorship and partnership, of course. So until we come your way next time, take care of yourself and bye.